who is literally a political health powerhouse. This woman has served in so many positions, I can't even get all the way through it. I'm going to start with she founded Spark Street Advisors, a public health think tank. She has been appointed by the Biden Harris administration to design, launch, and implement a $7 billion USAID emergency initiative to deliver 18 COVID-19 shots to low and lower middle income countries. I don't even know. I'm going to start with all of the academic. Columbia, Georgetown, Queens. Nina, you are really an impressive person, and I want to appreciate how much you've done out there in the world. Thank you for being with us today.
Thank you, Trevor. I'm excited to be here today.
So exciting. Okay. Where do we get started? Because I feel like we're in this insane public health crisis with 2,000 measles sort of events, right, in our country this year, when in the year 2000 we had zero. So where do you want to get started here? What do you want to talk about?
I think vaccines is a great place to start because it's such an easy and effective intervention. It's safe, it's effective, it really saves lives. And so it's true we've really gone off track with the current administration's policies to cut back on vaccines, push back against science, and a very simple intervention that we know works. And it is disturbing, and it should be worrying to people.
It is very worrying, and I do believe anybody out there, please talk to your people, talk to your family and friends. Vaccines are safe and incredibly effective, and there's a reason why we live a lot longer today is children don't die young because of all these things that they're vaccinated against. So this is a very important message for everyone out there.
Yeah, and unfortunately, the government has made some recent decisions, including cutting back on something called hepatitis B and the birth dose for hepatitis B. That's not something we think about because it's a vaccine that you get as an infant, as a newborn, and it protects against liver cancer later in life. So this is actually one of the first and most effective cancer vaccines. And unfortunately, the government has just pulled back from providing that and is currently considering a range of measures which will cut back on a whole range of childhood vaccines.
So if you're going to have a baby soon this year or the next 5 years, et cetera, do you have to ask for this vaccine to be given to your baby right away? Because I do believe it's right at birth.
Yes. And it's going to depend on your state coverage and how the states are, I think, going to have to pull it up and get in the game here. The problem with the federal recommendations is they're the ones that guide whether or not these interventions are reimbursed by our health insurance. So whether or not that's Medicaid or Medicare or in general, whether or not they're reimbursed. We have an excellent program in the U.S., or we had one where childhood vaccines are free to everyone. And so by pulling them off this list, it means, unfortunately, only the people that can afford to pay for them are going to get them.
I find that infuriating. I cannot tell you, my daughter is starting her family this year. I'm so excited. We have some happy things happening. Yay. But just the sheer fact that you have to specifically ask for this, if you can't afford it, your child could potentially have liver failure or cancer or all sorts of terrible health issues down the road. And we really are not going to understand the impact of this for 20, 30 years.
That's right.
This policy.
And when we hopefully regain the House and the Senate in the years to come and the presidency, we still have a group, we call it in our technical terms a cohort, which is a couple of years of kids who were not offered this life-saving intervention.
This is an absolute disaster. So, Nina, what you're saying, which please, Lord, we're crossing our fingers, that in 2 to 4 years we start to see change and we can roll back some of these terrible decisions, one of which, I think one of the very first executive orders that Trump signed was to get rid of USAID. And I see that on your resume you had a job with USAID distributing $7 billion worth of COVID shots. Talk to me about what your thoughts about watching USAID go away and how that impacts the world, but also comes back on us in the long run.
Yeah. So the first couple of executive orders, I think, were particularly devastating, well, to all, but also in public health. The very first one was to pull out of the World Health Organization, which is the global organization which develops norms and standards by which we all live by and collects evidence to improve our lives and make them healthier. The other one that was devastating was on diversity, equity, and inclusion, which meant that so many of those programs that are successful in targeting the people that need help the most no longer can now no longer focus on those populations. And then there's USAID. USAID has been an agency that has been providing what we call soft diplomatic support to countries around the world, life-saving tuberculosis vaccines, HIV medications, sorry, not life-saving tuberculosis vaccines, but tuberculosis medicines to actually prevent and treat tuberculosis, which is the leading killer among adults worldwide. Food aid, school and education aid. This is an agency which is known in every country of the world and something that makes people proud to be American because you can travel. I've traveled all over the world to over 150 countries. I've worked in over 150 countries. And people are excited to meet Americans because they know that these programs have benefited their populations. And the Trump administration, through DOGE and through Mr. Musk, got rid of those, destroyed it, and closed the doors.
Literally destroyed it. And this also causes further outbreaks of terrible things that happen around the world. Ebola, I think there's a couple other outbreaks of other awful diseases that we can't really be on the ground really helping out, finding ways to get through it and help the people there. But what that does is it adds to the spread of those diseases.
That's right. I mean, the Centers for Disease Control down in Atlanta also has presence all over the world through our embassies around the world. And they're such a encouraged, recognized force of good around the world. When a country has an outbreak, they knew that they could rely on the CDC's labs or experts to come in and help them contain those epidemics. And that was good for them. And obviously it was good for us too, because it meant those diseases didn't cross borders because we stopped them at the source.
I just love that phrase, the force of good. And what we were known for throughout the world was being able to set up this USAID, which is helping people get necessary or very important support from education, as you're saying, health, vaccines, food. It's just mind-boggling to me why we pulled back on all of this, and now we're blowing up little boats in the Caribbean. That's a whole nother conversation. But again, sitting with me today is Nina Schwalbe. She is a master's in public health, a PhD, a public health powerhouse, as I said. And we're really learning a lot. And I don't want people to lose this information. And I feel like that's part of what this administration is trying to do, which is like wipe out the science and come up with these odd beliefs like autism is caused by vaccines. What do you do when people say that to you? What do you say, Nina?
Look, that study was debunked ages ago, and there's tons of evidence against it. And I think we just have to keep emphasizing that science really is science, and there are things that we know. We also need to say when we don't know. And I think that was some of the issue during COVID is maybe people were overconfident when there were things that we don't know. Science is sometimes communicated unclearly. But in the case of vaccines, the evidence is clear. There's no lack of clarity. Science education, rebuilding the NIH, which the National Institutes of Health has also been destroyed, which means most of our universities have had to cut back on their research around the country. We need to keep our emphasis on science and on teaching people to understand it and communicate it better.
Just for the record, the leading cause of autism is old men fathering children. Frankly, that's the biggest problem, and it's a genetic issue. I know this is across the board. I got some pushback when I said this before. It's not vaccines, people. It really is not. And we do have to support, and this is the NIH and how much we support research, especially for cancer. I don't think anybody I know anywhere hasn't met somebody or had a family member who's been attacked by cancer, and we haven't solved this problem. We've gotten much better therapies, but we've got a long way to go. So what are we going to do about this? I don't know how we reverse all this.
Well, we have great interventions that have been funded in part by the U.S. government to develop, and it's great. It's interesting that you mentioned cancer because there's a fantastic vaccine against cancer, and that's the cervical cancer vaccine given to adolescents, and it basically prevents cervical cancer, which is a leading killer in the U.S. and around the world.
Have we cut back on? Is there recommendations to cut back on that as well?
I don't want to jinx anything.
Okay, we're going to stay positive.
But
don't say it.
But RFK has a particular beef, or maybe that's not the right word, has a particular problem with this vaccine, and it's one that he's been attacking for a while. So I think all vaccines are in scope for reversal of the current policies. And what you said as well about information being taken off the sites, the CDC has had a lot of its facts and figures and data taken off its sites, and that makes it harder for even states to respond when there is an outbreak.
So I do believe this is part of an overall attack from an educational standpoint, is if you don't educate people, you take information away. Although, again, all this information is available out there because of the internet. If you want to do a deep dive and actually do your research, please, people, do your research. Go look everything up. And a lot of things are missing from our U.S. website, many things, including a lot of diversity and equity issues. And actually, I was going to mention our maternal mortality rate, infant mortality rate in our country, which is abysmally low. I think we rank down there with like 35th or something in industrialized countries. This is something we should be so deeply embarrassed by, I personally believe. And hurt by it. It's not even an embarrassment thing. We have children and moms dying because they're not getting proper health care.
That's correct. And this is about access to care. And it's about really access to care for people that are high risk or people that are low income. And that's why primary health care is so important, and why that's something we really need to focus on. So everybody that needs to see a primary health care, and what that means is prevention, it means your contraceptive, it means your well baby care, it means your prenatal visits, all of those basic things. It means your access to treatment or advice when you have a chronic condition. That's primary health care, and that's something we really need to fight for.
And you know what? We've seen a lot of cutting back on Planned Parenthood that did much of this basic reproductive health care work, which is screenings, mammographies, vaccines, et cetera, et cetera. And this is to me a war on people who can make babies. And it is not okay. And in fact, it hurts every single one of us. And in the long run, there's just because of all these negative outcomes, it's going to be more costly.
One of the things that really worries me is the pharmacy access question, is that we're now very lucky we can go into our local pharmacy and get vaccines, and that's reimbursed by the system, or we can get contraception. And there's going to be a strong pushback on what we can get when we enter the pharmacy. And that's something we really need to watch out for. A lot of people,
my goodness,
as you know, get their basic medications from their pharmacist. And how that works is something, again, we really, that is going to start with vaccines, and it's only going to creep further forward.
So it's executive producer Lisa Hannock has a question. Go ahead, Lisa.
I just wanted to ask Nina, because you talked to Trevor about people going on the internet and doing the research, and there's so much on the internet that there's so much disinformation out there. Where, Nina, can people go to get accurate information right now? Where would you suggest they look?
I would suggest they look at the World Health Organization's website. I think, unfortunately, our CDC has pulled out much of its accurate information. Okay. And a lot of the information now on the CDC website is outdated. So I would recommend that if you want the state-of-the-art recommendation, you look at the World Health Organization's website.
Okay, that's a really good thing to point out to people. Go to the World Health Organization if you want really good, realistic, scientifically backed information, not our own, which is, again, highly humiliating. I cannot believe we're doing this. All right, I want to pivot a little bit because we talked a little bit before we got together on the air, which is drug policy and what you think is important and how we cope with what's going on. And there is some good news out there, everybody. Our drug overdose rate has gone down by double digits, I believe, in the past 2 to 3 years. It is due to mostly naloxone, which is a drug that you push into, or you spray into somebody who's overdosing a nose, and it actually brings them back to life, literally. Talk to me about this.
Yeah, I think harm reduction is what we call harm reduction, means that we know people are going to have unhealthy behaviors, and the idea is how do we help make those unhealthy behaviors healthier, and that's called harm reduction. And naloxone should be available in every pharmacy for everybody to pick up so they have it in their pocket. I'm from New York City, as you know, and you see people in the subway who are ODing, and you want to have naloxone in your pocket to be able to revive them.
Oh,
Another
goodness.
great new intervention is test strips, so that that kids who are doing drugs or people that are doing drugs, whether or not we think that's the right thing, they're doing it. They can test and make sure that their drugs don't have substances like fentanyl in them. And
So
that should be
there's
available
literally
everywhere.
fentanyl test strips we can have that can be in every high school bathroom,
Could be.
on the subways and any public space. Fentanyl test strips. And what does that do? What would people do with these strips?
Well, they'd be able to test whether or not they're drugs. I mean, people take drugs, whether the drug is what they think they're taking. And they'll be able to test the safety of those drugs. Because when people aren't expecting fentanyl in their drugs when they OD. And yeah, it should be like condoms in the bathroom, menstrual pads in the bathroom.
Absolutely. Absolutely.
The mini pharmacy in the bathroom at the school.
And I will put this again in that same part of just like every one of us, every family, every friend has been touched by cancer, addiction is pervasive. It's ubiquitous. Every one of us knows somebody who's overdosed. It hurts me. It hurts my heart. It's just a terrible, terrible story out there. And with some of these harm reduction policies, we can really bring down these overdose deaths, which we've literally seen.
Yeah, one of the best examples of the success of harm reduction has been needle exchange because people were shooting up drugs and getting HIV as part of it. And by having needle exchange programs where people could literally make sure they were using clean needles, that was one of the major interventions in the U.S. to bring down the number of cases of HIV.
So one of my thoughts about certainly this administration seems to be trying to attack, narco terrorists, et cetera. I would like to see us to solve the problem at the root, right? Which is to understand why addiction is such a huge problem here in this country. How do we treat people rather than blowing up a couple small boats? Actually, not a couple now. It's about, I don't know how many strikes we've made. This is a much bigger issue, and it comes down to public health policy, right?
I think everything's a both and it's about supply and about demand. I think I also don't agree with blowing up boats, but thinking about the supply and how it comes into the country, that's an important issue. And educating people about how they can be safer is as important, if not more.
So my job is licensed marriage and family therapy. By the way, this show is being brought to you by my company, trevorcrow.com. I am with Nina Schwalbe. She is a master's in public health, and she's got a PhD, again, public health powerhouse. So for me, the baseline for all addiction is disconnection and isolation and not having strong, secure attachments around you and you're feeling left out, et cetera. How do you feel we cope with this crisis of isolation in our country? We've certainly seen an incredible increase of death of despair since the early 2000s, especially it's hit the male population terribly. Have you got any thoughts about this, Nina?
I think you probably have more as a therapist, but I think building what we call a caring society and really thinking about how people make it through life from birth all the way up to end-of-life care is something we can pay more attention to.
I love that, a caring society. And we do it. Administration is literally saying that empathy is not a good idea. I know, actually, I think Elon Musk is saying empathy is a negative in the Western ideology. I don't know. It's interesting.
I missed that.
That's
glad
right.
I missed that.
So before we wrap up the show, I want to ask Nina a couple questions because I think she might be considering a possible run. Could you talk to me about what's on your mind, Nina?
Yeah, I am exploring or thinking about public office. I think when that executive order came down and destroyed our field, which is public health, which is such an important one, both domestically and internationally, I just thought I could sit around and complain about this, or I could see what I could try to do about it. And we have such an important opportunity now to protect what matters, rebuild stronger, and prepare for the future that it is something I'm seriously thinking about.
Okay, so if you were to run, exactly where and for what? No, nothing. No, okay. So, I like the fact that you're really wanting to fight for and look to support the public health policy out there. And you certainly, of all people, have the information to fully apply to pushing that and maybe saving many, many lives.
And I think the other part about health is when we talk about health, something you also know from your practice is we're not just talking about health care. We're talking about your mental well-being. You're talking about access to safe and affordable housing. We're talking about access to healthy food that we can afford. And we're talking about decreasing stress and anxiety. So health and stress and anxiety from perhaps being picked up by ICE when you walk out the street. So there are a lot of stressors that affect our health. So the other message for me is health is more than healthcare. Health is about security and feeling comfortable and safe where you are.
So important. Absolutely, absolutely, desperately important. And today it does feel like our public health safety net is disintegrating. People do feel under attack. I do know people who are afraid to send their kids to school now.
Exactly.
It goes on and on. The stressors are incredibly high.
Yeah. Yeah.
Any policies that you would like to directly impact, say you were elected? Or if you were to like be part of a administration, what would you like to immediately address?
I have a whole bunch of things, and luckily, in my position, I also get to be an advocate, and I get to advocate for these regardless of where I am. But first and foremost, primary health care for all, making sure people have access to primary health care services. I think affordable housing. You were talking with your previous guest about housing credits. It's been done. It's possible. We know how to do it. Housing credits, in addition to housing subsidies. That's a great place to start. One thing that you don't have so much out here, but I don't know. My family lived nearby for many decades, but I'm a city girl, and the trains in New York are super annoying, and the subway's super annoying, and that's anxiety producing. And I learned recently that the signals in New York, some of them on the C train, are from the 1930s.
Oh, we love vintage, but not on our trains.
Yeah, so there's a lot. And then, I mean, there's so much to do. And it's about fixing systems. It's not just a lot of, it can't be a whack-a-mole approach, because if you whack one mole, the other one, I don't know if that's but we need to really have a systems approach. Health, housing, transit, safety, rights, they're all connected.
Lisa, Hannock has another question.
Well, I just wanted, thinking about how health policy is such a big issue in our country right now. Can you tell us if there's a lot of expertise right now in our legislature on health policy, or how many people would you say in the legislature are sort of qualified to really know a lot about this?
I haven't completely fact-checked this, but according to the internet, which we've already discussed, I think there are a couple of medical doctors as representatives, but there are very few people with public health degrees. And public health is how we think about policy and access and how we tie it together.
Well, you certainly have the credentials. You've worked so hard across the board. It's been really impressive to hear what you've done. And your expertise is going to be more in demand than ever before. And I do believe we are going to have people dying due to what's happening now. And you're in need, and you're important to us as a country, globally, frankly, because USAID, we have people. I think it was Nick Kristof in the Times who wrote about how many people are dying due to pulling back these funds.
Yeah, that's right. We already have people dying. We were providing life-saving treatments, tuberculosis, HIV medication, HIV PrEP, around the world, and we have pulled those services. And don't believe what you read from the administration, because they have pulled those services. And now we're doing deals with countries where there's all this quid pro quo. We get access to their genetic data for a pittance of life-saving medicines. But we pulled those programs, and people have died, full stop.
And if I can, be even a little more cynical about this, if you're a person who says, well, why should we be spending money to help others, when we have so much need here, we can't neglect the fact that this really impacts our soft power as well, which we alluded to earlier in the show, that, if we're not doing these things for other countries, that impacts what we can leverage in terms of, our political power, our moral power.
Well, and we're no longer, we're also no longer in the know. There was an outbreak of a virus. We used to be there with the CDC right at the outbreak of a virus. And now we're not there. We're not at the table anymore. And that's also really important to protect Americans.
Yeah.
Important. And don't forget that if we leave an open space here, another country or another superpower will jump in and fill it. And that, again, is terrible for us over time. And it's a brutally, this is not good for anyone, and especially all these years of we've developed a lot of trust, a lot of expectations, a lot of positivity. Like you're saying, people looked at Americans and were like, oh, I'm so glad you're here. You guys have helped us out. That's going away. And we will not get the support from our allies. We will not be able to go and help. And we don't know what the future is going to look like because we've thrown this all out of the window, right?
Yep.
So, best case scenario, I've got 2 minutes left. What would you, I know you care about systems and how to look at this, and this is not about a whack-a-mole. And by the way, I think Project 2025 was an incredible wish list / they freaking did it. We need to do something like that from the Democratic side. Are you part of a group that's making those kinds of plans on a systemic level? Because I agree with you completely.
I'm not part of the Democratic kind of machine. I'm not part of the Democratic machine, but I think there are a lot of people with a lot of good ideas who have ways to fix this, and I'm enthusiastic about that. And I think we have some great politicians in New York. You have some great politicians here. We have a new mayor who's bringing a lot of enthusiasm and excitement in New York City. And I think there are people who are going to see how to do things differently.
I like that positive future. Thank you so much, Nina Schwalbe, for being here. We had a good conversation on public policy, public health policy. This is Trevor Crow. The show is Trevor and Friends, brought to you by trevorcrow.com. Everybody's struggling at the end of the year. You can give me a call. I am a licensed marriage and family therapist. Thank you so much. This is WGCH 1490.